In the Toledo district of southern Belize, Hillside Healthcare Clinic partners with the Ministry of Health to provide medical care to more than 8,000 patients each year. Hillside has expanded services to include physical therapy, which offers rehabilitation services to individuals of all ages with a variety of disabilities. The World Health Organization estimates that 15% of the population has some type of disability, and that 20% of these individuals could benefit from the use of an assisted device such as a cane or a walker. In the Toledo district, this represents about 1,000 people. Unfortunately, only 5 to 10% of people who need assisted devices actually have access to them.
Community-based rehab is a proposed means of meeting the needs for people with disabilities in the developing world. I think it empowers people with disabilities and their families because it's not a passive approach to care. They're training, they're caring. The person with a disability is learning how to promote themselves.
Community-based rehabilitation engages not only the different businesses, the different healthcare facilities, the healthcare professionals, but it also uses and engages the schools, all the different players within the community, uses what assets exist to help meet the needs of the disabled. The Belizeans know what they need, what they want, and how to get things done here in country, much more than we do. And so we really try to utilize that wisdom and that knowledge that they possess from a cultural standpoint as well.
I've enjoyed working with the students, going on school visits to teach them about disability and to tell the community and the students that even if you have a disability, you can still be a part of the community and the schools.
Belcampo has a partnership with Hillside and with the community in general because a lot of our goals here are tied to helping the community. It was the synergy that happened between Hillside and our staff themselves while Hillside was helping us. So it's kind of playing it forward. We have a wonderful maintenance department with a head of maintenance who's been here for more than 10 years and very, very skilled woodworkers. And it's also just an awful lot of fun to work with the maintenance department because it seems like anything we dream up, they can make.
Okay, the first project I started is when we met with Monica and she told me about what she's doing at Hillside. So and then she asked me if I can there any way that I can assist her making some like wheelchair or stand for someone to help themselves with. We use our scrap lumber here. It does cost time and labor, but the thing is that we all give that for the person using it.
A lightweight aluminum walker might be nice, but if it goes bad, if it rusts out, which often happens with the salt and humidity, if a wheel breaks off, there are no parts here to replace that. And so even though it might be helpful for a short time, it's not generating any sort of local economy as someone isn't getting paid to make it, versus if we have made out of mahogany or out of emery wood, we can pay a craftsman and then you're stimulating the local economy. The challenges of a donation model, especially in a developing world, are multifactorial. It takes a lot of time for things that are shipped down to make it to us. So if we needed a walker yesterday, we might wait 4 months for it to go through all of the necessary processing.
When you rely on outside resources, it's just very expensive, it's very demanding, and it's just not sustainable.
The last thing I would say about the donation model is when things are purely given, there becomes a sense of dependency, and that fostering a culture of dependency is not empowering to anyone. And I would much rather have time used in brainstorming and thinking, okay, what else could we use, or who maybe should make this if they have experience in one area, rather than using the time waiting for a box that's going to be coming down.
Here in Belize, they make the equipment with local materials, durable materials that will withstand the rough terrain that exists down here. And if something does break, you need to be able to have those materials to replace them and repair them.
You're also promoting local craftspeople, and you're promoting their creativity and their self-worth because they're making things, they're getting reimbursed for it, and it goes back to that, it's made locally, it might mean a little bit more. There will be times when we need supplies that we can't find here and that we can't make here. And there has to be a balance. And I think that balance is the key in finding and using locally produced and sustainable sources. But also, when people want a metal walker, if they can find it, they might choose to use that. And that's okay. That's one of the benefits of community-based rehab, is that it's not this model must work in every country. It's saying that these are some guidelines, and it's going to look different in different parts of the world.
The Hillside and Belcampo relationship is one example of a mutually beneficial partnership formed from the tenets of community-based rehabilitation. Together, Hillside and the community partners determine an appropriate cost of the device for the recipient based on the materials, labor, and equipment used to make it. This process fosters the development of relationships, empowers craftspeople, stimulates the local economy, and provides helpful, locally made equipment to individuals with disabilities.